Hi, Dr. Don Pelto here. I want to go over today about the five tips for preventing common foot problems. We have many patients in the office that come in when they have pain. But what I see is a tendency to have certain traits before people come and see us. And I'd like to give you a couple of things that you might want to consider to avoid coming to see us in the office. The number one thing to do is make sure that you're wearing the correct shoes. Many people's foot problems come from getting a new shoe that's either too tight or not long enough or not appropriate for their feet. And another problem is wearing shoes too long. So they wear a shoe for more than 6 months to 9 months, depending on their activity level. So shoes can do really harmful things to your feet. So for example, if you're wearing a shoe that's too small, it could cause your toes to cramp up and cause hammer toes. It could cause calluses. It could lead you to have Achilles tendonitis. It could lead you to have heel pain, a lot of other conditions like that. If you wear a shoe too long, a lot of my patients, what they do is they wear the worst shoe for their hardest activity. So doing something like that could cause you to develop plantar fasciitis, other types of tendonitis, and things like that. Also, in terms of shoes, if you have a very flat foot, you have to be careful because having a flat foot and having a poor shoe can really cause some harmful effects. Okay, the number two thing, if you're dealing or wanting to avoid foot problems, frankly, is doing something called foam rolling or loosening up the back of the calf. Something I spend most of my days talking to my patients about is that the issues that affect our feet usually stem from higher up in your body. So, for example, the Achilles tendon or pain in the back of the heel stems from the muscles in the back of the leg. Same thing with the plantar fascia, it stems from the back of the leg. And there can be a lot of good that can be done from foam rolling the back of the calf. I find that just stretching isn't usually enough. I find that foam rolling can be very effective. Get a foam roller, roll the back of your calf. There you can roll it straight. You can roll it a little bit to the side, a little bit to the other side. I think 5 minutes should be enough once or twice a day. I don't recommend going buying a lot of things online. I have many patients, they've tried these like foot stretchers, they've bought night splints, they've bought Strasbourg socks, they've bought all these things to try to deal with their heel pain. I would say just start with the foam rolling and then see how it does. Specifically, if you're doing a lot of activity, for example, if you're doing a lot of walking and you don't usually walk, or let's say you go to Disney and you do a lot of walking that you're not used to doing, those types of things can make your calf very tight. Now, I'm not saying that calf pain is a problem. It's not the calf. It's what it can cause further down the road where it can develop into plantar fasciitis and Achilles tendonitis and other types of foot problems. So then number three, the way that you can prevent common foot problems is don't wait to see a doctor. I have many patients that they say, well, I had this problem, whether it be an ingrown toenail or foot pain. The rule of thumb is that if you've had it for over 3 weeks, or if you've spent more than $300 on stuff on Amazon, you should probably see a doctor. It will get you better faster. Many times we delay treatment because we think we're going to try something, we think it'll get better. And it's really not the most efficient method is to go to urgent care. Don't go see someone at urgent care because they're not going to really do much. Many times, even primary care is they're not going to do too much. You should probably see a specialist. I'm a big advocate of getting the simplest and quickest treatment as fast as you can. Give me an example. Patients, they might go to the emergency room for plantar fasciitis or heel pain. All they can do is get x-rays and they might give you a walking boot, which you don't normally need anyway. Or if you go to the urgent care, they look at your ingrown toenail and they give you an antibiotic, but they don't really treat the ingrown toenail. So don't wait to see the doctor. And number four would be don't just treat it yourself. And so once again, if you've had it for 3 weeks, and you've been kind of trying to treat it on your own, certain things you don't want to treat yourself. So, for example, you don't want to trim off your own callus by buying a razor blade on Amazon. You don't want to deal with your own ingrown toenail by trying to dig it out. You don't want to I have some acquaintances, they just find an antibiotic from someone and take an antibiotic for something to make it better. You don't want to do that. So don't try to do home treatments. That can delay. I had an experience of a patient. They were from Brazil and they got a treatment for warts and it was an acid and they put it on and their wart didn't get better and they kept putting it on, putting it on, putting it on, and it developed into a very deep wound that was problematic. So I don't recommend you treating things on your own without kind of knowing what you're doing. Okay. And then the fifth thing that you can do to prevent any problems is when you see a healthcare professional, when you see your primary care, when you see someone, take off your shoes and have them look at your feet. And if there's anything that's concerning, mention it to them. Many of my patients, they go to the primary care, and the primary care doesn't even have them take their shoes off, and they're not mentioning their problems to the primary care. Many of our referrals come from the primary care. And so if you mention it to them, they can get you in faster to see a specialist. Okay, so those are 5 of the methods that you can use to prevent foot problems in your feet.